Hello and good evening. I'm Melisa Idris. Welcome to Consider This. This is the show where we want you to consider and then reconsider what you know of the news of the day. The COVID-19 pandemic revealed just how strained and undervalued Malaysia's care workforce had become. But several years later now, have their conditions improved? A new study by the Recare Project maps the pressures, inequalities and policy gaps surrounding Malaysia's care workforce and what must change to make it more resilient. Joining me on the show are the good folks from the Recare Project, Anis Farid, who is the Principal Investigator, and Shazana Agha, who's one of the co-principal investigators. Both of you, welcome to the show. I'm very curious to know more about this project and the study, the recent report that you launched. So talk to me a little bit about what this project is, who's involved in it, and why you decided to focus on the care workforce, particularly post-pandemic. Anis, if I may come to you.
Yeah, okay. So first of all, thank you for having us here today. I'm really happy to have this opportunity to share more about this important study. So I think to answer your question, what we know is that women are societally expected to be the primary caregivers of their families. And we know that during the COVID-19 pandemic, this burden increased a lot, the unpaid care responsibilities. Simultaneously, our care workforce, which undertakes the paid care work, and this encompasses those from healthcare, social care, and domestic care, this workforce is also primarily women. What we saw during the COVID-19 pandemic was the demands on women who were undertaking paid care work increased a lot because of the nature of the COVID-19 pandemic. Right. A lot of these women were frontline responders, for example. And this is the unique double burden that women in the paid care workforce carry. They have to manage their paid care responsibilities and their unpaid care responsibilities. And in times of crisis, especially like COVID-19, this burden increases. But we don't actually know about the experiences of these women, like what did they really go through. Yep. So what we wanted to look at essentially is how these paid care workers negotiated the balance between their paid care responsibilities at work and their unpaid care responsibilities at home. And also more broadly, the impact that this has on their well-being, because we believe that the resilience of Malaysia's care ecosystem hinges on the well-being of our care workers.
Definitely, yeah. So Recare, the Recare project is essentially a collaboration. So you came together, researchers came together to say, hey, we suspect that the care workforce, particularly women, are under immense strain, and we want just to see whether the data reinforces that by talking to them, by documenting their experiences. Is that correct? Am I correct in phrasing that way?
You're absolutely right. Okay. We had suspected, that this was something that was being underestimated or not being looked into more thoroughly, and we felt that it was really important to bring this to the fore, and for us to understand better what were the experiences of care workers during COVID. What are the experiences now? Right. Yeah.
Could I just get the both of you maybe to define the care workforce? Anis, you mentioned health, social and domestic, and sometimes I think maybe it would be beneficial if we understood who we mean when we say care workforce, because sometimes people think, oh, is that just nurses or maybe domestic helpers? So when you looked at this study, who did you look at and how did you define them?
Okay, yeah, you're absolutely right. Our study takes a very broad approach to defining who a care worker is, because we're taking a more ecosystems approach where we believe that all of these different sectors under care, like healthcare, social care and domestic care, have an important role to play in supporting Malaysia's care needs. So amongst our healthcare workers, who we were looking at were doctors, nurses, and hospital cleaners. For social care, we looked at social workers, particularly those within the social welfare department, JKM. And then we also looked at those who provide care for children, the elderly, and people with disabilities. And for domestic care, we were looking at migrant domestic workers from Indonesia and the Philippines.
And these are all paid care workers. So we haven't even touched on the unpaid care work. Yes. Right. So let's talk about the findings of the report. I want to delve deeper into that. I understand that this has been a labor of many years since the pandemic was officially over. So how long has it been? And maybe talk to us about what's changed, why you started to look at this at the start of the research, and what has changed since, and the findings of the report. I'll go to the both of you, but Anis, if we could start.
Yes. Okay. So in terms of our findings, so broadly, this was a very large-scale nationwide study, and it was also mixed methods, meaning we did both qualitative research, so things like interviews, focus group discussions, as well as quantitative research, so like surveys. So for us, we started with focus group discussions with over 140 women care workers across Malaysia to really understand what were the issues that they were facing during the pandemic and after. And then from there, we created a survey which was undertaken. The survey had 1,500 respondents, care workers, men and women. And the survey was really assessing the well-being of the care workers, both not across time, essentially, so before, during, and after the COVID-19 pandemic.
I see, okay.
Yes, and I also want to give a bit of context as to what well-being is, because we're going to talk about it a lot.
Right, you're right.
I feel like it might be important
to define it. Yeah.
Exactly. So for us, well-being is composed of four core aspects, and we measured subjective well-being, which means that we allowed the care workers to assess how satisfied they were with these aspects of their lives. And so our four key aspects that we were assessing was how satisfied were care workers with their physical and mental health, their job satisfaction, their satisfaction with their work-life balance, and finally their satisfaction with the social support that they had for unpaid care work. So simultaneously, we also wanted to make the measure as holistic as possible. So we also considered contextual factors. So for example, how satisfied you are with your work-life balance is going to depend on how much time you spend on your paid work and also how much time you have for your unpaid caregiving. So we really wanted to capture as holistic as possible this idea of well-being. And for what we found, we saw that during the COVID-19 pandemic, 3/4 of the care workers that we surveyed, they experienced a decline in their well-being. And what we're talking about here is over 1,100 care workers saying during the pandemic, my well-being declined. And what we're seeing also is that post-pandemic, 2/3 of them have not recovered to pre-pandemic levels of well-being. So what this tells us is that the effect of the pandemic, it wasn't temporary, it's ongoing, and it's shaping the realities that care workers are facing day to day, even now.
Wow, that's really heartbreaking, isn't it? Because we knew the pressures put on care workers during the pandemic, but you would have thought that years after that conditions would have improved or things would have gone back. But it really, I think, just deepened some of the vulnerabilities. Shazana, how do you view the findings? What was the most significant for you?
I think what was the most significant for me was how care workers are intending to leave the workforce, and a lot of the times it's to do with wanting to spend more time with family, wanting to have that time to be able to do their own unpaid care work. And I think while we emphasize the importance of paid care work, we often forget or underestimate the toll that unpaid care work can also take on an individual, including care workers themselves. So we're always looking into care workers as people who serve us, as people who serve care recipients. But are we also looking into what their own personal care needs are?
So you're absolutely right. The number of people who were thinking about leaving the care workforce was quite shocking to me from your study. 1 in 3 of Malaysian care workers intend to leave their current position within the next 5 years. I was so shocked when I saw that in your report. It's staggering. What do you think it could mean for the care industry, the care sector, if this comes true? If 1 in 3, if 35%, 34.5% say, I no longer want to do this because it's taken too much of a toll on my well-being. Anis?
I think before we go into what the implications are, I want to emphasize that this statistic, this 1 in 3 statistic, is the number amongst Malaysian care workers. It's actually much higher amongst migrant domestic workers.
Oh, wow.
It's over half want to return. Over half want to leave their current jobs within the next 5 years. And obviously migrant domestic workers are under different pressures. For example, like the long-term familial separation, things like that. They want to be reunited with their families. But what this statistic, this 1 in 3 number, really means for Malaysian care workers, there's 2 things actually that it could mean. The first is that they're thinking of changing their jobs in some way, whether it is moving from the public sector to the private sector, or changing jobs altogether. The second is that they want to drop out of the care workforce. As Shazana mentioned, one of the reasons that is most commonly cited is wanting to spend more time with family. But the top reason that's cited is actually job stress and burnout. So other commonly cited reasons also retirement. But when we're looking at those who say they want to retire and they want to spend more time with family, a lot of them are actually working age, meaning they're in their prime working age. They're under 50 years old.
But they're already talking about retirement.
Yes, they're already thinking about retirement, which means that they want to drop out of the care workforce, essentially, drop out of the workforce altogether. Yes. So this is obviously really concerning because it shows that the structures that we have are not supporting women and the unpaid care responsibilities that they have, right? Like maybe workplaces are not flexible or supportive enough of the unpaid care responsibilities that these women have. Simultaneously, there's also this huge problem with the burnout that the care workers are facing. Those who say that they want to change their jobs because they're burnt out, you can see that they have higher levels of burnout than those who are citing other reasons.
Shazana, is this concerning to you, this staggering statistic, which I have now learned that it's probably higher if you take into account the migrant domestic workforce?
Yes, of course. You know, it's concerning, and it's also more concerning is what are we doing about it? You know, are we taking this seriously? Are we taking stock of, you know, things that happened during the pandemic, and you know, and responding to it through policy interventions and programs? So I think that's the bigger question.
I have to say, I mean, you suspect it's the case, and I've heard anecdotally of friends who say, you know, they want to drop out of the healthcare workforce or social care workforce. But when there's data to support your suspicions, it's really quite worrying.
Yeah.
Let's talk a little bit about the other shocking, important finding that came out from your survey, which was 52.6 hours was spent on paid care, a week was paid on care. Actually, I bungled that up, so I'm going to leave it to you to share with us this important finding. Talk to me about what you learned about how much time was spent on paid care work and unpaid care work.
Okay. So you're absolutely right about that. 52.6%.
Was that correct?
52.6 hours per week. That is post-pandemic. So on average, the care workers that we surveyed are reporting that they spend 52.6 hours per week on their paid care work. And obviously, this is a very high number. It is above the maximum hours that is outlined within the Employment Act of 45 hours per week. And this is why we see such high rates of burnout amongst the care workers. In our study, in our analysis, what we found is that there's a high correlation between those who spend long hours working at work and facing burnout. So the long hours is contributing to the burnout that they're experiencing. But it's not just that, because the reality is that the work was really demanding and intense during the COVID-19 pandemic. During the COVID-19 pandemic, in fact, like 1 in 3 care workers were reporting that they were spending over 70 hours a week working. And it's obviously not just about the amount of hours that are being worked that's intense, but it's also about how much is being done within those hours, right? Because COVID-19 was a crisis, it was an emergency. And we saw how it affected the healthcare frontliners. What we saw less of was what was happening to our social care workers. For example, a lot of them are managing clients who are elderly, who have complex care needs, and they needed to be able to meet those needs while also managing disinfection protocol, SOPs, less staff within, like, for example, a nursing home. And you can imagine the toll on them was huge, and that's something that we didn't really know, we didn't really see, right?
It was all invisible work, wasn't it?
Yes. So, I mean, to go back to, I guess, the bigger question of what the implications are, when we know the impact that the pandemic took on our care workforce and that they have not recovered to pre-pandemic levels of well-being, they're still facing burnout, things like that, is leading to this high intention to leave the care workforce, first of all, which then impacts not just their well-being, right? It's also impacting the well-being of the nation, because as it is, we're an aging nation. We don't have enough care workers, and if our care workers don't want to continue doing their jobs because they don't feel supported enough, they don't feel valued, they don't feel appreciated, you can imagine the quality of care that Malaysians will receive is going to be compromised.
I mean, what a wake-up call. It really is. Shazana, can I ask you, so just now Anis mentioned that in addition to the paid care work, the number of hours put in for paid care work, women especially have to put in more hours for unpaid care work at home. Maybe talk to me a little bit about that, because unpaid care work is so often falls on women to carry, and what that means for the care workers and caregivers when policies don't recognize the gendered dimension of it.
Yeah, I think, you know, care workers own unpaid care work. That was something perhaps really was not seen. And through the study, we found, we got to know more about the struggles of care workers in navigating their own paid care work. A lot of them had to bring their children to work. You know, some of them had to leave their children alone at home, and while they're at work, they're thinking about the children at home. How is my 10-year-old doing? You know, not being at peace. You know, having to bring 3 children along to work and navigating roadblocks, you know, every day. So these are some of the stories that were shared, and you know, I feel like I've not seen a recognition of this anywhere really.
Sacrifice, isn't it? It's a sacrifice that they've done.
It's a sacrifice, and also, do they really have to go through this? You know, is it possible to support them better, and how do we do this? So, I mean, one of our key recommendations actually is to talk about how we need to integrate care workers within our crisis preparedness plans and programs. Yes.
They're not?
Well, some of them are. So you see doctors and nurses. These are the more, you know, front of mind occupations that, you know, are recognized. But when we talk about, for instance, hospital cleaners, social workers, you know, here and there, and then you talk about elderly care providers, childcare providers, domestic care workers, they were all performing really essential functions during the pandemic, caring for us, whether within the hospital or out of the hospital. And the thing is, so what we're saying is that if a pandemic were to happen again, we don't know. It could happen.
It could, very well.
Or it could be another crisis. Climate change is here. Or it could be, you know, the simple idea that we are going towards an aging nation. You know, we need to prioritize care, and in doing so we need to look into the well-being of our care workers.
100%, definitely. Tell me more about the other recommendations from your work, because you've laid out the problem. You have data to support the hypothesis. But where do we go from here? We know that we need to build. We need to take better care of our care workforce, the way they've taken care of us. What were some of the recommendations that you put out?
So we've put forth 5 pillars of recommendation. So essentially, these were derived together with care workers themselves. So some of these, so under each pillar of recommendation, we have some sub-recommendations that came directly from care workers themselves, as well as researchers.
Oh, good.
Yes, as we sat down together to analyze the data through our participatory data analysis sessions. And so the pillar 1, for instance, is to enhance working conditions of care workers to ensure that care work is decent work. So what does that look like? It means fair wages, job security, ensuring there is adequate mental health support, you know, looking into representation of care workers in decision-making spaces. So these are all aspects of what we call decent work.
Yeah, okay.
And we want to make this happen for care workers because we cannot continue to rely on care workers' individual resilience or individual coping mechanisms. We need structural support for them, and we need structural change.
Definitely. Okay, so that was one. Talk me through some of the other major pillars. I'm sure we can't go through in detail every single recommendation, but what do you think would be you would personally consider the most urgent reforms and most achievable? I might say some reforms take longer, take years, maybe a more political will, but are there low-hanging fruit that you think we can win in terms of providing for our care workers, Shazana?
I think a low-hanging fruit would, of course, be better mental health support. I think that we already have some structures, we already have some initiatives in place, but we need to improve them, certainly. And one of the things that we found was that a lot of the time, care workers don't access mental health support that are available simply because they have fear of confidentiality breaches. So what we are putting forth as a recommendation is to ensure that mental health services that are provided for care workers should be independent. They should be independent from the management and from administrative positions within the care institution. And certainly and the other thing that we found from our study also was the significant impact of personal violence on care workers, and that's something perhaps Anis could maybe speak to a bit more.
Tell me more.
Okay. So in terms of violence, there were 2 measures of violence that we assessed, whether they were experiencing violence in the workplace. So these are things like bullying, harassment within the workplace. But we also asked if they were experiencing any violence at home. Or in their personal lives. And when we were looking at those who said that they wanted to leave the care workforce within the next 5 years, we saw that generally those who experienced violence in the workplace, they reported higher rates of experiencing violence at the workplace. And then when you're looking at Malaysian women specifically, those who want to leave their current jobs within the next 5 years, they actually reported higher rates of experiencing personal violence. We're not exactly sure why this is. This is definitely something that we want to look further into, but it shows that addressing the violence experienced by care workers both in the workplace and at home might be crucial for retention strategies and to support their well-being overall.
Wonderful. In the few minutes that we have left, can I ask both of you, for the audience watching at home, you've put in years of work to put together this report. You've spent time talking to care workers, learning about their experiences. For many of us who often take for granted or don't value enough the work, the contribution of care workers, do you have a reminder for our audience, just based on the work that you've been doing and your observations? What would you like the public, and who knows, maybe a policymaker or two who may be watching this, to bear in mind the next time we think about the well-being of our care workforce? Shazana, may I begin with you?
Actually, can we begin with Anis?
Oh, sure. Have a think first, and I'll come back to you, Anis.
Okay. Okay. So I think what we see in the 13th Malaysia Plan, for example, is that the well-being of the rakyat is one of the core pillars. Yeah. And I think what our study really shows is that we've really neglected looking into the well-being of our care workers and how they're doing post-pandemic. I think at the same time, for most of us, the big tangible changes that need to happen might seem a bit like out of reach because, for example, maybe it's the policymakers that need to make that change and make that difference. Yeah. But what we know from having worked with the care workers for the past few years is that valuing and appreciating the work that they do can go a long way. A simple thank you in recognition of the sacrifices that they went through during the COVID-19 pandemic, that is a good place to start for, I think, all of us.
Yeah. We come across so many care workers in our daily lives, and maybe we don't, we take them for granted, right? Shazana, have you had a thought, a little think?
Yes. So perhaps, I mean, the idea of care as gendered, you know, we really should be challenging these stereotypical ideas that care work is women's work, you know, that, you know, between a husband and a wife, you know, it's all on the wife's shoulders. You know, we need to be challenging these gendered ideas because it's just not sustainable. Yeah. It's not sustainable for the average woman, and it's certainly not sustainable for the care workers lah.
Absolutely. Yeah. Both of you, thank you so much for coming on the show and sharing some of your work, and for all the hard work that you've put in to put together this survey and this report. I appreciate you and the whole of the Recare team. Thank you.
Thank you.
That's all the time we have for you on this episode of Consider This. I'm Melisa Idris signing off for the evening. Thank you so much for watching, and good night.